Hi everyone, my name is Megan Booher and I did my drug infomercial presentation on inhalants. So what are inhalants? Inhalants are a lot of different substances. It isn't one specific thing, but they're used to get high by inhaling. So these are products that are bought easily at multiple different stores and they're found all over in the home and the workplace. And so there are four different types of inhalants that are commonly found. It can be a solvent, an aerosol, a gas, or a nitrite. And then some commonly used items for inhalants include spray paint, markers, cleaning products, aerosol cans, anything like that. So some quick facts about inhalants. They're used to get high by breathing in the fumes, and this high typically only lasts for a few minutes, unlike other drugs, so people use them again and again over a few hour span to keep drawing out the high. And nitrites are a very common form of inhalant, and they're often abused for sexual pleasure because they relax the blood vessels. Um, Inhalants are commonly used by teens and young adults, and often one of the first drugs that people try as children. Inhalants they usually try before marijuana or anything like that. And some common slang terms for inhalants include poppers, huffing, whippets, rush, and snappers. So, some physical effects that happen from using inhalants could be anything from slurred speech, poor coordination, dizziness. Vomiting and headaches are also a common side effect from using inhalants. And inhalants affect the nervous system, which is why it leads to slurred speech and poor coordination. And the symptoms of using inhalants are somewhat similar to something you would see in someone who is drunk. And some of the withdrawal symptoms from people who are staying away from inhalants after heavy usage include nausea, sweating, mood changes, loss of appetite, to name a few. And then there are also several mental effects that come with using inhalants, and they can create hallucinations or delusions. And they also cause a sense of euphoria, which is why so many people use them for that effect. They have psychoactive effects when inhaled, and long term usage can lead to neuropsychiatric effects such as depression, anxiety, and insomnia. So, there are several signs to look out for inhalant use, especially among teens and kids when they may start using them. Some of these include breath that smells chemical like or just odd, red eyes, the drunken appearance, like I talked about, which is with the lack of coordination and the slurred speech, and then also a loss of appetite among kids is a common symptom of using inhalants. Um, Parents should also look out for missing cleaning supplies. This could include paint cans or glue as well that the kids are using to inhale, and also mood changes such as a lack of appetite or not wanting to do well in school anymore or just being kind of out of it. So, some of the risks and consequences of inhalant use with long term use, there's a lot more issues. It can lead to liver and kidney damage, can also lead to nerve damage, as well as delayed brain development and overall brain damage. And it is possible to overdose on inhalants, so it can cause death. And there's also a phenomenon referred to as sudden sniffing death syndrome, which can occur with one time usage. And this is when inhalants cause the heart to stop, which leads to cardiac arrest. Repeatedly using inhalants can create a substance use disorder, so people do get addicted to inhalants just because of the euphoria that it creates. And they're also used for sexual pleasure. And they can also cause hypoxia, which can lead to death. And nitrites, which are used as inhalants, are definitely associated with risky sexual actions and could lead to STDs. And then here's my reference page. Thank you all for listening.